I'll give you We'll give you just a second or two to get connected. But if you're here to talk about inclusive planning for alcohol misuse prevention, you are in the right spot. My name is Jen Morrell, and I have the privilege of serving as the Managing Director for the Ohio Center of Excellence for Behavioral Health Prevention and Promotion. Let's see. One more second to see folks are still joining. Thank you for taking the time out of your busy day. We know today is a big day for many of us in the prevention world and our friends. So thank you for spending the next hour with the center and our esteemed panelists. We are excited to have a great conversation about some projects that are happening across the state and a dialogue with each of you about, considerations for inclusive planning and implementation of alcohol misuse prevention policy. So as I'd mentioned earlier, my name is Jen Morrell, and I have the honor of serving as the Managing Director for the Ohio Center of Excellence for Behavioral Health Prevention and Promotion. Before I hand the mic over to our facilitator today, I just wanted to just share a little bit about the Center of Excellence in case this is your first time joining us. We are a relatively new organization in the prevention field, but our purpose is to really uplift all of the good prevention work happening across the state, elevate prevention science, and to really support each of you as you're working to institutionalize those core components of behavioral health prevention and promotion science. We want to become the front door to Ohio's prevention community and help to assemble all of the resources, the work that is happening across the state in one place that's easy to find and access. And really, we want to provide venues like this for us to connect and learn with and from each other. So today we have Tony Ashton, who is the prevention coordinator for the Fairfield County Adam H Board, and Barbara Adams-Marin, who serves as the supervisor of prevention services for Clinton and Warren counties at Talbot House down in the southwestern region of the state. And our moderator, Tessa Miracle with the Pacific Institute for Research and Evaluation, is going to guide our panelists and each of you through a conversation about some of the work and considerations that we can all be keeping in our mind as we think about inclusive alcohol prevention policies. So I will hand it over to Tessa, and thank you again so much for joining us.
Thank you so much, Jen, and good afternoon, everyone. Thank you for choosing to spend this hour with us. I know that we all have competing priorities right now, and I'm very grateful that you've chosen to spend your time with us today. We are so delighted, and I'm personally excited to get to spend some time with Tony Ashton and Barbara Adams-Marin. Today, we're going to take a look at culturally relevant strategies and policies that promote safe and legal alcohol use, and the importance of considering diverse populations in our planning, and considering, our friends in recovery, our different needs across the continuum of care as well. So I, don't want to do a disservice to these ladies. I know that you guys have some very impressive work that you've shared with us, and I'd like to invite you each to share a little bit about your own background. And I'd like to start with Tony, if that's possible. I know, you have shared with me this beautiful collaboration you have with some neighboring counties, and sort of unique use of data in planning and incorporation of individuals with lived experience in planning. So I'm going to hand it over to you for that macro level introduction, and then we'll hand it back to Barbara. So we'll start with Tony's presentation now as we advance the slides, and then we'll switch over to Barbara.
So I just want to say thank you so much for having me here to talk a little bit about what we're doing with our COP, our core grant. And so I know in prevention, we use a lot of acronyms. So I am going to try and explain sort of how I got here, how we got here. And so I am a part of the COP RCORE, which stands for Community of Practice. And RCORE stands for Rural Communities Opioid and Response Programs. And those are both funded through HRSA. And our lead consortium is through Ohio University Voinovich Center and PIRE, which is the Pacific Institute for Research and Evaluation. So there are actually 4 local coalitions that are part of this master consortium, and we've actually been working together since 2018. And even though these counties are not geographically really near each other, we are all rural communities. So it consists of Fairfield County, where I'm from, and then also Ashtabula County, Sandusky County, and Seneca County. And so one of our key tasks with our grant was to look at stigma. And so we had a work group that has been working on stigma. We actually designed and implemented a stigma survey in each of our counties. One survey was around mental health stigma. The other survey was around substance use disorder stigma. And so we realized from the information we received from our survey that that there are multiple levels of stigma, and that just one strategy isn't going to work. So we have to have multiple strategies that build on each other. So in January, we started discussing community recovery friendly events. We all knew that we had in common that we have community events that focus around alcohol. And are held in alcohol-centric locations. And that the idea that these community events basically focused on alcohol are not including those in recovery or even those that just don't drink. And so if an event is truly recovery friendly, they actually may not be successful in our communities because some of our communities really rely on alcohol events, alcohol businesses. So we knew that whatever we did, we needed to do it with a neutral tone and not as accusatory, or we wanted to make sure it was soft in nature. So I will say that we researched, we got feedback from our local coalitions, and we actually had a person in long-term recovery that attended some of our work group meetings. So if you will go to the first slide, and I'll talk about what we came up with. So we looked at recovery statistics, and we were pretty surprised about how many people are actually in recovery. So we have a national statistic, and then we have a statistic for Ohio. So you can see under the Ohio statistic, 7.5% of the population consider themselves to be in recovery from alcohol or another drug. We actually then came up with some local statistics for our community. So I have the statistics for Fairfield County, which for Fairfield County, it is actually 11,979 people that consider themselves in recovery. So this is something I think will be important for the folks that we talk to that are doing the events in our community focused on alcohol. Next slide, please. So we came up with all different reasons why people don't drink alcohol. So it's not just those in recovery, but there are there are lots of reasons, and there are probably even more reasons than we have even been able to come up with. So when you think about an event that's centered around alcohol, you are actually not including any of these people that are listed that for whatever reason don't drink alcohol. Next slide, please. So we came up with some possible ways that people could have an event and take this into consideration. So next slide. So we thought it would be a great idea if events would partner with the recovery community to offer some recovery spaces for people that aren't going to be drinking. That the people that are holding the events could actually focus on the content of their event and have alcohol as a complement, not as the main focus. And then also to create invitations or flyers that clearly state that non-alcoholic beverages will be available. So next slide. Many times events will have non-alcoholic drinks, but they are at the same venue or tent as the alcoholic drinks. So we would ask them to possibly have an area away from where the alcohol is. If it's a big enough event that there's a first aid tent or area, it could be near there. And that there would even be maybe a separate booth or separate line, so people that don't want to purchase alcohol would not be in the same line as people that are purchasing alcohol. And then to maybe mark that space with a yellow balloon. So if you are not familiar with yellow balloons, that is a symbol for recovery safe places. And it actually started with Grateful Dead concerts, and it has expanded. And people that know what the symbol of the yellow balloons are will know that that's a safe place for them to go to be with other people from their recovery community. Next slide. So we also thought it might be helpful to suggest that they offer good non-alcoholic drinks. So, you know, you could serve it to everyone and anyone. You would cut costs, so save money. You can also save calories. And that you utilize fresh organic ingredients instead of drink mixers. We want folks to avoid using the word mocktail because that can actually be a trigger for those that are in recovery. Next slide. So if you want more information about recovery events that are taking place in communities, you can use this QR code and it will take you to our website that has more specific information on it. And next slide. And so this is just a representation of our core group and the HRSA grants that has made all this possible. And then I also want to say we have an OU student working with our master consortium, Mackenzie Kay, and she really was so monumental in putting together this information. She wasn't able to be here because she has class. So that is the end of my presentation.
Wonderful. Thank you, Tony, for sharing some background on your work and how these wonderful resources came to be. I also shared the flyer that you shared with us in the chat. That'll be part of our breakout room discussion in just a few minutes, but we want to give our friend Barbara an opportunity to share some background, some macro level of her work, and just taking a look at their own approach to this issue in their community. So Barbara, I'm going to hand it over to you now.
Thanks, Tessa. Thank you for the invitation to be here. And I want to give a huge shout out to Tony because I'm so glad I got to present with you today, because just hearing some of what you're doing has so informed my thinking about next steps for our project, the Be One of Us initiative. I think these kinds of gatherings are so important because we always learn from each other. And I want to thank you so much for what you shared. Talbot House Prevention Services in Clinton and Warren counties is pretty new. We've been around since July of 2020, which, if you recall, was right smack dab in the middle of COVID. So starting a new program at that time was both an opportunity of a lifetime for me, dream come true, but also a real challenge, because our program is funded 100% by the Mental Health Recovery Board serving Warren and Clinton counties. And their charge to us was to reach underserved parts of the population in new and different ways using a community-based approach. So COVID presented some unique challenges as well as some opportunities. Knowing what we knew about what was already going on, and knowing that the board wanted this different approach and reaching new people, we decided right from the get-go that our focus would be on adults. We had opportunities to align our work with youth serving organizations. And so we wanted to address what we saw as a part of the community that didn't always get enough attention. And the opportunity that COVID presented was for us to spend the first 3-4 months really just taking a deep look at Warren and Clinton counties, looking at as much data as we could come up with, and really exploring what was going on through some conversations with key people in the community, and ultimately identifying that we wanted to focus on adult drinking attitudes and behaviors, and in particular binge drinking. The local data that we had indicated that about 15% of each county adults reported binge drinking behaviors. And we also knew that for the past, at least 3 cycles of data collection of youth behavior, we weren't moving the needle in the right direction. We weren't seeing the age of first use increase or fewer students reporting underage drinking. And so we really thought that this might be a different approach. We hypothesized that if we could address adult attitudes and behaviors associated with alcohol use and promote low-risk drinking, that we would be able to influence the youth in the attitudes and behaviors that they developed. We also knew that alcohol use among adults was increasing during COVID, and it seemed like a good time to address this particular issue with the adult population. And when I say adults, I know that we also had some subgroups like older adults and women that were key parts of what we were planning. And then we also knew that we had some hot spots. Talbot House has offices in 3 different communities in Clinton and Warren counties, and we knew we would focus in those communities, but we also knew that one of them had a higher rate of binge drinking than the others. And so we definitely wanted to see if we couldn't start there. The first step was just to assess readiness. And I know that so often the process of collecting the information about the community, understanding what is really going on and where that community is, whether they even recognize it as a problem, is really important, but it's not the fun part. And yet I've, in my own experience, have found if I jump into, I know what the problem is and I have a plan, then I have failed miserably. So we were really fortunate to have this time to really take a close look. And in looking at readiness, using the triethnic model, both counties had very low scores, indicating that not only did they not see it as a problem, it wasn't really even a blip on their radar screen. So the scores were between a 1 and a 2 on that triethnic scale in the first go round. And so in our first 6 months of the initiative, all we wanted to do was bring it to people's attention. We just wanted them to see the message about binge drinking, to see what our community norm was. And we wanted to present it in a positive way, not 15% are binge drinking, but 85% of the adults were not. And then hopefully get inside their head to raise some questions, get them thinking, well, what is binge drinking, and why is that important, and do I binge drink? Those kinds of things. If we could get inside their head to that extent, we knew that we could then begin to build more education and awareness around that. So next slide, please. So thinking about adults and where they spend most of their time, it seemed to make sense to reach out through the business community. During the day, most adults are working, and so one of the first groups we approached was the Lebanon Chamber of Commerce, or the Chamber of Commerce in Wilmington and Franklin as well. It turned out that Lebanon was really the right place to begin. And this is sort of an accident, but there was this conversion of our prevention goals, but also what the city of Lebanon was trying to do coming out of COVID. They wanted to expand their entertainment district, increase the number of outlets serving alcohol, and expand their DORA area. But Lebanon, if any of you have been here, and I really encourage you to come, is a very historic city. It has a lot of charm, and it prides itself on being family-centered. And it was very important to the Chamber of Commerce and to the city that as this expansion of opportunities for alcohol consumption occurred, that they keep that family-centered historic charm as well. And so they were receptive to the low-risk drinking message that we were presenting. And what you're seeing on the screen is part of our brochure that both advertises all of the great events that are happening in the city through the year, but also information about what binge drinking is and what's going on here. Could I have the next slide, please? This is the inside of that brochure. And one of the things that I think you see is how closely we were able to align the low-risk drinking guidelines and messaging with some of the interests of the Lebanon community and the DORA, and sort of putting them side by side so that as people are thinking about coming to one of the events and using the DORA sites, that they also were presented with the low-risk drinking guidelines. Again, our intention is to come at it, as Tony was suggesting, from a neutral or positive point of view, not highlighting the problems, although certainly Lebanon was interested in not having a lot of drunken disorderly conduct as they expanded opportunities, but just creating that sense of that it wasn't totally a negative message if people did decide to drink, that there was a way to do it responsibly, and we were trying to define that. The emphasis on being one of us, I think we wanted to encourage people to join in and and maybe in some ways take advantage of the human tendency towards herd behavior. But we definitely wanted this to be a positive message, not something that was coming off as seeing alcohol in always a negative, totally negative light. What I like about what Tony was saying is, we didn't really ever think about there being safe places where there was no alcohol. And so, Tony, I'm taking that away from your presentation, and I definitely want to share that as we go forward. Could I have the next slide, please? So we began with 5 businesses who were willing to sign on as partners, and in the next year, we were able to add 38 businesses. And a partner displays that center medallion in their window. They agreed to have information available about low-risk drinking at their location, and to participate in some trainings for their staff about what that means. And the little decals on the right-hand side are stickers that we can put on the Dora cups. Again, putting that message in front of people as a reminder, also as a way to get them to be thinking about low-risk drinking guidelines as they are drinking alcohol. Something else that we've started to do is participate in the events, doing ID checks and wearing a Be One of Us t-shirt and on the back has the low risk guidelines. So as people turn around to get the bracelet, they see the low risk guidelines. What we found is that it is an opportunity to actually have one-on-one conversations with people attending the events and to talk a little bit more about what all of this means and why it's important. Can I have the next slide, please? We've also taken advantage of the partnerships that are in Warren County, both the Warren County Safe Communities, which focuses on reducing DUIs and alcohol-related accidents and fatalities, and the center component is our side of the coasters, and then on the left and right are the other side of the coasters. One is the Safe Communities message about safer driving and reducing risks from alcohol. And on the right is the Substance Abuse Prevention Coalition's messages about underage drinking and the importance of adults talking to their kids about the risks of alcohol. So we've had successful partnerships with both of those organizations, in particular use these coasters during Alcohol Awareness Month in April. Next slide, please. The final message that we have, and this is our key focus going into this fiscal year's efforts, is really emphasizing that adults are role models for youth, and whether that's parents, grandparents, or just any adult in the community, we model if we are modeling the responsible drinking attitudes and behaviors, low risk drinking guidelines, that is what our youth will see. And we want them to internalize what we do as much as what we say. And so one of our other messages has to do with responsible drinking's more than not just getting behind the wheel of the car, but the adults as role models for youth really allows us to draw in adults, and not just through the community events and other business connections, but also through the school programs that we now have as part of our program. Because while we started only as a community-based preventions program. We now are in most schools in both of our counties with school-based services. So this is how it is evolving, and we are hoping to really roll it out in the Franklin community within the next year. Again, it's based on that community's readiness to accept this message and be partners with us in promoting it. So we're excited about the way it's gone so far. Obviously, this is not something that we are going to measure success or outcomes right away. I'm hoping that in the next 2 cycles of collecting data about youth, we're going to start to see the age of first use increase rather than decrease, and more youth reporting that adults in their lives are talking to them and are sharing their disapproval of underage drinking. We've also started to increase our online presence. That's a little bit of a challenge for us, but we have now a way for people to get direct information about Be One of Us, and we're including QR codes on our information so that we can update that the information faster and keep it current, and also recognize that that's how a lot of people get information. So I'm new at using QR codes. I did take yours, Tony. So, but trying to get into the social media and online presence in a bigger way. So, thank you.
Thank you, Barbara. I really appreciate it. And I just want to call attention to, you did bring up the triethnic model. If that's a model that you haven't worked with in the past, or maybe you want to read a little bit more about, I'm going to share a link in the chat for you to review on your own time. Just want to make sure that that is accessible to everyone. I so appreciate you ladies providing this presentation. We did have a couple of facilitation questions for you, but I'm getting some questions in the chat already. So I think people are really ready to join the breakout rooms with you and learn a little bit more in depth about each of our models that are being used here. So I know if you've attended a prevention exchange in the past, this has been focused on you asking all the questions you would like. So we have a couple of facilitation questions for you. Tony and Barbara have asked to seek some feedback from you. So we have some questions that you can discuss in your rooms. I will drop those in the chat for you. We are going to join our rooms for, let's say, 12 minutes. I'm going to go ahead and open the rooms now. You are able to choose your own room as you would like. We're not going to assign you. The rooms are not recorded as well. So if you'd like to join Tony to talk a little more in depth about her resources, please join room 1. If you'd like to join Barbara, please join room 2. If you have not seen an icon pop up on your screen, it's okay. It may be in another spot depending on the version of Zoom you have. So if you go into the the bottom ribbon of your Zoom screen, right before the button that says leave, you'll see an ellipses. You'll be able to click there and you should see some breakout rooms. If you have a different version of Zoom, it might look like 4 squares stacked up. If you cannot find the breakout rooms and how to join, you are welcome to unmute and we will troubleshoot that with you. But if you can select your room as you would like now, we're going to pause recording and I'm going to drop those questions into the chat for each breakout room. Start our recording, everyone. I feel like no matter how much time we give in the breakout room, right when I close it, I always hear, oh, it was just getting good. So I'm so sorry that we had to cut you off in your prime. We now have some time for some report out and some sharing. So would love to hear, I think Jen calls this, what was your aha moment? What was something that stuck with you or stood out to you that you were discussing?
So I'm going to put Holly on the spot. I would ask Holly to share with what happened this week with Ohio University with the flyer. with the recovery spaces.
Absolutely. There was an event where they wanted to do a drinks with the dean's event, and the person here that received it was like, oh, I have some questions, and so came to me and saying, do you have anything? And I said, oh, we have this great flyer. And so they sent it off to University Communications, and now it has spread like wildfire, because people were like, oh my gosh, we didn't realize that having an event titled that way could cause people not to come. We never even thought about that, and how, we can have drinks at an event and that's okay, but how do we find the both and? So we are catching all the people we want, because we want everyone to come see the deans, not just people who want to have a drink. And so that was exciting. So, and I just wanted to appreciate, I don't know if it's Tamisha or Tamisha, who noted that this was really an effort with prevention and recovery. So thank you. I don't know if you want to share a little bit about what you noticed in the flyer.
Oh, I don't remember if I said anything in particular.
Oh, no, just talking about how you recognize that people who with lived experience were involved in the process.
Yeah, I was asking about that because it just seemed like I was just saying that I don't drink. So it's like there's anxiety time to time when I have to go to a bar or go to an event and I'm asking I might just want juice. And I've actually asked for a seltzer water before and got a hard seltzer. I didn't even know that was a thing. That was before I guess the White Claws, and then to drink that and realize that I'm drinking alcohol, and just having that, being uncomfortable out in just events that as an adult that I would go to, and asking for just a basic drink and worrying about if it's going to be spiked or cross-contaminated. And so to hear, to have that forewarning, or to have those signs that say, okay, this area is not for that, that's I think that's nice. That's wonderful. And I'm glad that people who actually live, that experience, say so, that their voice was used in the process, because it really makes a difference, versus someone who says, okay, well, we'll just do this because we'll think that'll make them comfortable. But someone who actually knows the anxiety that comes with not drinking alcohol and having, those worries of I might ingest some, so.
Absolutely. And it's how, disheartening is it when it's supposed to be an event to build community, to offer the opportunity to connect. And gosh, we've placed this burden on someone where there's this emotional turmoil around, oh no. Yeah, thank you for sharing.
I think that's an interesting point about how there could be almost reverse stigma at an event where alcohol is being served for the people who are not going to consume alcohol, and the need to recognize that. I'm learning so much from you all. I appreciate that point.
Thank you. And thank you, Barbara, for segueing us to room two. Room two, did you guys have, what sort of highlights did you have, or what were the themes that stood out to you from your discussion?
One of the things that was gratifying for me to hear was the recognition that the behind the scenes work was really important. Taking the time to collect the data, do the readiness surveys, have the conversations with the key people in the community, and building the trust and the relationships, and all the time that took was real work. I really, it was gratifying. Thank you for Jen for recognizing that it was so important for the success of the project, but it's not glamorous work. It doesn't, get a lot of wonderful comments and stuff. In fact, some of our work colleagues at the time, we were in a different building, really didn't think we were working at all. So it was, do those people ever work? Yeah, that kind of thing. So.
Absolutely. The spreadsheets are not as pretty as those, or eye-catching as those flyers, are they? Mm-hmm. They're just not as fun.
Takes a long time to get there.
It does. It does. And I heard some consistent themes through both projects, this idea of, building readiness, working across the continuum, collaborating with business, collaborating with your community, and incorporating voices. So what we produce is meaningful and represents everyone. Absolutely. What other items would you like to share before I hand it back to Jen for our closing?
Well, for me, I think everything was very informational. I've learned some things, some stuff I didn't know. Now I do know, and that's always a good thing. And that way I can share and also go look to see more on this. Look more on this information for myself. So for me, it's always I'm just always willing to learn new things, and even just from what I've heard about even what the thing when Holly, what Tony when they was saying about the drinking piece of, I didn't know none of that. See, a lot of stuff that's new because I didn't know that. So it's always good for me to learn new things. Even with Barb, it's good for me to learn new things and to make me aware and also make other people aware of it. So this is good for me.
Wonderful. We're so glad that you enjoyed and learned from our panelists. I know every month I learned something new. And I'm just so grateful for everyone for spending your time and energy today. And I just want to thank Barbara and Tony one more time. It was a pleasure getting to work with each of you in this process and to learn from you as well. I'm going to hand this back to Jen now for our closing and our evaluation, but I just really want to thank you guys for your time.
Absolutely. Thank you, Tessa. Thank you, Tony and Barbara. There are a couple ways to connect with us if you're not already familiar with the Center of Excellence. We have a monthly newsletter, and actually the August newsletter should be going out any minute. So if you're not receiving it yet, go ahead and scan that QR code if you want to know what's coming down the pike for the next 30 days or so. We have handles on all the social media channels. And of
Jen,
course,
thank you so much. I don't know if we're seeing a QR code right now, though.
oh, can you not see the Q? Oh, hang on.
No, sorry.
Thanks, Tessa. How's that? There's the QR code to sign up for our monthly newsletter, our social media handles, and then, of course, our website. It's a quick form. We don't spam you. We don't sell your information, of course. And then finally, we will follow up with everybody individually because we know there are folks who had to hop off a little bit early, but we do have a quick 4-question evaluation form. We really love to hear what folks think about the discussion, the facilitation, and the format in general. We make tweaks to Prevention Exchange all of the time based on this feedback. So thank you for joining us. Next month, we'll be releasing more details shortly, but our topic will be suicide prevention among the Black youth community across Ohio. So we've got a couple of really amazing speakers and media campaigns that we're excited to share with you. And that will be, I believe, Thursday, September 27th. It's the last Thursday of September. But same time, same place. And we'll look forward to seeing you then. Take care, everybody.
Thank you. See you next month.
Bye-bye.